Let's talk about the thoughtful progression on a side plank utilization and how we can incorporate that in our stability paradigm. Side planks have been shown to be one of the best exercises for stability for the lumbar spine in the chronic pain patient. So let's have you roll over onto your side, please, Allie. And the first thing we want to do is just that, in a three-point position, just lying on the side from the hip, just engaging this. Now, what do we have to be concerned about with side planks? The shoulders, all right? Because if there's any shoulder issues, this may not be a good exercise. So if there are shoulder issues, side planks aren't going to work. We're going to have to get the patient offloaded and do some lateral flexion exercises to engage the QLs. So be aware of that. Frankly, with any of your planking, watch out for the shoulders. So first start is just right in through here. Once they can hold that, we're going to have them come up onto their knees. Now, two things. I like to take this hand and place it right here and always make sure that head and neck is straight. Now bring this back down. Pre-brace, tighten the abs, and then bridge. I say bridge or lift up. They can come up into a bridge just like when they did their bridge on the back and come back down. So you can do it just like you're doing your side bridges. Stay nice and square. We're all about alignment. Tighten the abs, bridge up, right? That's phase two. Hold it for 3 to 5 seconds. Make sure you get that pre-brace in. When that gets easy, doing 3 sets of 15 of those, we're going to go to a split stance first. Spread the legs, that'll make it a little bit easier, and then bridge up. Staying nice and square, all in through here. Hold it, again, 3-5 seconds. They can do reps. You can go up to holding 20 seconds if you want, but make sure you pre-brace first. The next one, stack them, all right? Now, this is going to put more pressure on the knee. So be attentive that if people have knee issues, they may not like this, all right? Because now all the leverage is going to be here. Allie, stay nice and straight. You're getting into an L, okay? That's it. See? You have to make sure they're square and go back down. Anybody can have people do planks. You got to make sure they're doing them in a corrective exercise paradigm. So make sure you stay nice and square, okay? We want to make it harder. Guess what? You're going to open up that hand, exactly. So she's going to pre-brace, raise up and through there, and then even the leg comes up. So that's going to be the progression as we work through it. As people get good at these exercises, all of your progressions are the same. What do? You change the level of foundation. She went from just lifting from her hips to lifting to 1 foot. We changed the level of foundation. What else can you do? You can change the amount of resistance. You can add resistance. You can use bands. You can use weights. We can put ankle weights on this. Or you can change the surface. We can make it an unstable surface. We can take a pad and put it under your elbow, and a pad and put it under your feet, and now she has an unstable surface. It's going to wobble. Exactly. It's going to make it a little bit harder. So all of those things are the same progressions regardless of the exercise that we're doing, all right? The key is being thoughtful in the application of it and not letting a patient go to an advanced exercise until they can do the entry level. Here's a caveat. Let's say Allie's just can't find the muscles to do a side plank. She just can't find them, all right? So I'm not going to break her down into the minutia of doing it properly in the beginning. I might say, oh, just lay on your outstretched arm. No, I'm sorry, no, on your hand, on your wrist. Straighten out the arm. Straighten out the arm like this, like this, like this. I might just start her like that and say, can you feel those muscles? Can you feel those muscles? Right? Just to get her used to it. And say, can you do that? Can you lift this a little bit and down? Can you feel that? She may just have to start with that and not worry about all the technical things and being really deconstructing it. But once she can say, yeah, I can find those muscles, all right, let's break you down. Let's get you to bridge, to brace, and come up and hold and really get into the specifics. So it really depends on the patient on how much motor control they have to determine how much you break them down before you build them up. Sometimes you just got to give them something simple so they can find the muscle, and then you have to break them down, deconstruct that movement pattern to where it's faulty. But if you try to start at that faulty movement pattern, if they can't find the muscles, they'll never get there. So you have to be a little bit attentive to that, and different patients can start at different levels. But that's the whole progress of lowest to extensive. And that's what all progressions are about. Knowing where to put them is where you as a doctor comes in.